So we're going to talk about a problem that affects a ton of men, but, well, it's rarely discussed out loud. We're talking about varicoceles. They're a major cause of testicular pain and can even be a factor in infertility. But what if the solution didn't involve a scalpel? Today, we're diving into a total game changer, a minimally invasive procedure that's offering some real hope. Does this hit close to home for you? You know, that dull, kind of dragging ache you feel at the end of a long day? Or maybe it's that quiet, nagging concern in the back of your mind about starting a family. If you're nodding along right now, you totally get it. You know exactly how much this can weigh on you, physically and emotionally. And look, that feeling, it's not just in your head. It has a real physical cause, a medical name. And understanding what's actually going on inside your body, that is the absolute first step toward getting some relief. Okay, let's get specific. See if any of this rings a bell. That dull, heavy ache that just seems to get worse as the day goes on. Or that really strange, unmistakable feeling often described as a bag of worms. Maybe it's discomfort after you exercise. If you're thinking, yep, that's me, you are definitely not alone. These are the classic signs. The easiest way to think about it is like a traffic jam, but in your veins. You see, there are these tiny one-way gates, or valves, and they're supposed to keep blood moving up and out. But when those valves fail, blood starts to pool and back up. That causes the veins to swell up, creating that pressure and discomfort. And all that pooled blood can raise the temperature down there, which, as you can imagine, is not great news for sperm production. So what do you do about it? Well, for a long time, the path forward felt like a really tough compromise. It basically forced guys into choosing between a couple of options that, frankly, weren't all that great. For years, the choices were pretty limited. You could try supportive garments and just kind of hope for the best, or you could go for full-on surgery. But what if there was another way, a door number 3 that offered a much better way forward? And this right here, this illustrates that dilemma perfectly. Look, on one side, you've got traditional surgery. That means an incision right in the groin or scrotum. It means general anesthesia, and it means a longer recovery, taking care of a wound. But then, look at the other side. Embolization? No surgical incision. We're talking about a pinhole, light sedation, not being put all the way under, and getting back to your normal life in just a day or two. The difference is just night and day. This is that door number 3. It's called Varicocele embolization, and it's a true alternative because it tackles the problem from a completely different and honestly a much more elegant angle. Here's the most important thing to get. We're not talking about surgically cutting anything out. The whole idea is to simply close off that faulty vein from within, which then lets your body naturally and automatically redirect the blood through other healthy pathways. It's a smarter, not harder approach. And the procedure itself is actually pretty amazing. It starts with a tiny entry point, a pinhole, usually in your neck or upper thigh. Then, using a live X-ray that acts like a GPS, a specialist guides a teeny tiny catheter right to the exact spot, the faulty vein. Step 3, they use these microscopic coils to basically create a roadblock inside that vein. And that triggers step 4, your body just naturally reroutes the blood flow. The catheter comes out, you get a tiny bandage, and that's it. Procedure's done. So let's just recap the biggest wins here. It's minimally invasive, it's an outpatient procedure, meaning you go home the very same day, there is no incision in your groin, no stitches to deal with, and you get a much faster return to your normal life. It's just a modern, super targeted solution. All right, so the procedure itself sounds incredible. I get it. But let's get down to brass tacks. What's life actually like afterwards? What can you really expect during recovery? And, who is this really for? Just check out this recovery roadmap. You head home on the same day. Most guys are back to their normal, non-strenuous stuff within just 1 or 2 days. No major downtime, no long, drawn-out healing from a surgical cut. Now, there is one important thing for fertility cases. Because this works with your body's natural processes, any improvements in sperm quality, they happen gradually, over several months. It's a process, but it's moving you in the right direction. So, who is this really for? Take a look and see if any of this sounds like you. It's a fantastic option for men dealing with that classic pain and heaviness. It's a major thing to consider for guys who are being evaluated for infertility. And of course, it's a huge one for anyone who just wants to avoid a surgical incision, or maybe for those who've had surgery before and the varicocele has unfortunately come back. So now you know the options. You know what's out there. But what's the right move for you? Well, the next step is all about getting personalized advice from a specialist. Because look, while this gives you the big picture,
every single person is different. The only way to know for sure if embolization is the best path for your specific situation is to sit down and talk with a specialist who can really look at your case and your imaging.
So I'll just leave you with this one thought. Just imagine it for a second. What would it feel like to get through your day without that constant nagging ache? Or to finally address a key fertility factor with a simple outpatient procedure? Could something that starts with just a tiny pinhole, nowhere near the actual problem area, really give you back your comfort and your peace of mind? For a lot of men, the answer is a definite yes, and that's a pretty powerful possibility to consider.